Good morning, good afternoon, and good evening, ladies and gentlemen, and welcome from across the globe to this important and timely conversation strengthening health systems through social protection. I'm Areej Javed, Communication Specialist at Jhpiego, Pakistan, and I'll be your moderator for this evening. We're so pleased to have you all joining us via LinkedIn Live. As we begin, please let us know in the comments where you're tuning in from, and feel free to post your thoughts and questions throughout the session. We'll try to address them in the comments. As we all know, the world is facing complex challenges, economic pressures, climate change, public health shocks, and at the heart of all of these lie vulnerable communities. In this backdrop, social protection is no longer a luxury, it's a necessity. When aligned with strong health systems, it becomes a powerful engine for resilience, equity, and inclusive growth. Today's discussion is part of Jhpiego, Pakistan's efforts to bring brilliant minds and practical perspectives on how we can align health systems and social protection frameworks to safeguard people, not just in crisis, but across lifespans. We'll talk innovation, policy, financing, and lived realities. And most importantly, we'll explore solutions. With that, let's formally begin today's session. I'm pleased to begin with Dr. Asim Ijaz, a seasoned public sector leader who serves as Director General at the Benazir Income Support Program. Dr. Asim is overseeing operations and strategic initiatives in social protection. Previously, he held the role of director at the Park Secretariat, where he contributed to policy formulation and operational excellence. Additionally, he has 9 years of consulting experience with USAID and other international organizations. Dr. Asim, a warm welcome to you. So my question
Thank
for you
you.
today is, thank you. So my question for you today is that given BISP's pivotal role in Pakistan's social protection landscape, how do you plan to enhance the integration of health services within existing cash transfer mechanisms to ensure a more holistic and impactful approach to poverty alleviation?
Thank you very much for giving me the floor. Benazir Income Support Program has certain initiatives that covers up the unconditional and conditional cash transfers. For conditional cash transfers, we have health and nutrition component, which was actually started back in 2020. Initially, it was started with the piloting of 9 districts, and then we rolled it out across Pakistan. And with the passage of time, the integration of health services with the existing cash transfer programs in the country or within the BISP, we already have implemented it, and we are now enhancing its coverage and the integration. For example, for coverage, we are trying to get more partners in it, and for integration, for the provinces after this devolution have their own mandate now. But having said this, I'll inform the audience that the integration with the social protection system of Sindh, we are actively involved with them, so that more and more can be included, the deserving people, the underprivileged people in the health and nutrition can be enrolled and can be served. For that reason, we are integrating our system with the Sindh Social Protection Unit as well. So far, the discussions have been made with them are like, we are in close commitment with them now, that the beneficiaries under the PMT 32, or in the flood affected districts where the PMT is 37. So we are closer to the consent with them that below 32, BISP will be entertaining those beneficiaries, and above 32 PMT, because the BISP has its certain mandate, so we cannot go beyond 32. So above 32, the Sindh Social Protection unit will be catering of those beneficiaries. Similarly, for enhancing the coverage, BISP itself is now expanding it, both the horizontally and the vertically. For example, for vertical expansion, We are increasing the stipend that have been raised from 10,500 in this year to 13,500, which is exactly trying to give more food diversity, dietary diversity. We are aiming towards that, and with the vertical expansion, with in this year, it has enhanced by almost from 9.3 million beneficiaries to 10 million beneficiaries. So BISP is working on the expansion of the program through horizontal and vertical expansions both. And for integration mechanism, we not with only the with the same province, we are also in close collaboration with the other provinces like Punjab and KP as well. And we are trying to have more inclusion in a way that when the systems will be speaking each other through the integration, so we can engage more beneficiaries, we can entertain more beneficiaries in it. So with the over the period of this 16 years of journey of BISP, what we have learned is like it it's not to work in silos. Actually, it's all about integration with your own unconditional cash transfer programs as well, and with the provincial cash transfer programs as well. And for that reason, we are actively working on it. So in addition, what I'd like to inform that we are enhancing this program with the provincial entities as well for developing the digital health platforms in the province level, and that will be again integrated with the federal with the BISP. So for that, we have engaged certain private partners as well with us, and obviously it will be injustice to the development partners who are actively engaged with us, like the Asian Development Bank, the World Bank, the UNICEF, WFP, and WHO, who are actually supporting us for this cause. On one hand, we are actively engaged with the private partners, and the other side, we are very much actively engaged with the development partners as well, who are continuously supporting us for integration of these systems with the provincial setups as well.
Thank you, Dr. Asim, for your in-depth perspective on business efforts, particularly on integration. I think that was very fascinating, and it was very inspiring also to hear business efforts towards enhancing coverage through horizontal as well as vertical inspections and collaborations with partners. I think that's particularly essential. So next, I'd like to introduce Mr. Mansoor Ali Masood, Senior Project Officer, Human and Social Development, Asian Development Bank. Mr. Mansoor manages projects on social protection and health, holding a postgraduate degree in public policy from the University of Warwick. Mr. Masood has worked for 8 years with the Benazir Income Support Program, where he played a crucial role in developing and managing national socio-economic registry and implementing both unconditional and conditional cash transfer programs aimed at enhancing health and education outcomes. He has also served in the federal ministries of finance and economic affairs, where he arranged development and commercial finance from international, commercial, and multilateral development banks. Mr. Masood, thank you for joining us today.
Thank you for having me.
My question to you is that the ADB social protection strategy emphasizes sustainable systems with universal coverage. In Pakistan's context, how is ADB supporting the transition from short term safety nets to long term integrated social protection programs that align with national health and development goals?
Thank you for this question, and thank you for the opportunity to this contribute to this important discussion. The Asian Development Bank has been supporting the government of Pakistan in social protection since 2008, and we have been supporting the Benazir Income Support Program since its inception. The ADB sees social protection as a cornerstone for inclusive and resilient development in Pakistan. And in the context of evolving social protection landscape, ADB is now focused on helping the country transition from a fragmented short-term safety nets to long-term integrated system, which are inclusive, adaptive, and aligned with the national health and development goals. We heard Dr. Asim say that, BISP is only catering to the 20% of the population. However, it is time with the rising poverty, climate vulnerability, demographic pressures, and institutional fragmentation. I think it is time to move beyond this 20% strata and cater to the population, wider population. So BISP has been the national leader in digital delivery and targeting as well as payment systems for more than 15 years now. And BISP and ADB has been a partner of it. We have been supporting BISP through our integrated social protection development program, which is ongoing. It's a $600 million program, and now we have recently approved additional financing of $330 million for it as well. Under the program, we are helping the ISPs to strengthen their institutional capacity building, expanding their socio-economic registry, improving delivery of the conditional cash transfers for health and education. And we are trying to complement it with the climate and disaster resilient enhancement program. It's a $500 million program that was approved last year, which supports the institutionalization of adaptive social protection as well. So I think building social protection requires more than just cash transfers. It requires integration across sectors, particularly health, education, and employment. And ADB is now trying to actively work to strengthen these linkages. For example, we are expanding secondary healthcare in Khyber Pakhtunkhwa through our Khyber Pakhtunkhwa Health System Strengthening Program, which aims to improve quality of care in the secondary public hospitals. This is our only health investment right now in the country. However, we intend to expand that, and we intend to expand that through supporting nursing education in Pakistan, because nursing are a pillar, a very important pillar in the health system, and not a lot of investments have been made into it. So going forward, we are going to support two nursing and health workforce strengthening program across Punjab and Sindh through our support. In parallel, we are also investing, as I said, in the nursing as well, and we would like to enhance our coverage, quality of care in both public and private sectors while creating employment opportunities, especially for women. Coming towards the labor market side as well, going forward, we are going to be working very closely for linking social protection with the labor market. We have an ongoing workforce readiness program in Punjab, which is doing wonders. We are committed to establish 20 centers of excellence under that program, and that program focuses on strengthening TVET institutions, improving industry linkages, and expanding access to skills training for the disadvantaged group. And now we are working very closely with the Benazir Income Support Program under our Integrated Social Protection Development Program to link these skills and enhance the skills of the poorest of the poor beneficiaries as well. So with these efforts, we are trying to bring an integrated approach towards human and social development in Pakistan. And we intend to break down the silos between sectors and building systems, which are number one, interoperable, number two, data driven, and number three, responsive to the people's needs. So going forward, we are exploring ways to linking the Benazir income support programs, the National Socio-Economic Registry, with health education databases for better targeting, monitoring, and service delivery. We also recognize the importance of provincial engagement. And as social protection increasingly becomes decentralized, ADB would like to work closely with the provinces in developing their own social protection policies, registries, and delivery systems. And we do not want them to work in silo. We would like them to be integrated with the Benazir Income Support Program. So to conclude, I would say that ADB's vision for social protection in Pakistan is to develop an inclusive, integrated, and future-ready workforce. We are committed to support the country in building a system that not only protects the vulnerable, but also empowers them through health, education, skills, and employment. Thank you very much.
Thank you very much, Mansoor Saab, for your detailed overview of the various programs ADB is launching to support government and health systems. And I think it's very imperative to focus on upskilling our workforce across the healthcare sector through integrated approaches. You also mentioned provincial engagement in your integration approach, which I think is a wonderful model to have a future-ready workforce. So thank you very much. I would now like to introduce Ms. Saman Rai, Director General, CEO, Punjab Population Innovation Fund, Health and Population Department, Government of Punjab. Ms. Saman Rai oversees human resource planning, monitoring and evaluation, commodity management, supply chain, and SPCC service delivery regarding Punjab Family Planning Program. Ms. Rai has served as Additional Secretary, Information and Culture, Director General Public Relations, Director General Public Institute of Language, Art and Culture, and Lahore Arts Council. Ms. Saman Rai, a very warm welcome to you.
Thank you very much.
My question to you is that given your extensive experience in family planning, could you share how social protection measures can be leveraged to further empower mothers and families, not only in accessing reproductive health services, but also in improving their overall well-being?
Yeah, thank you very much. And I'm also grateful to you and Jhpiego for the first, webinar on such important topics, because normally we discuss health and then family planning and then social protection. But I think they are all interconnected, and they are all creating synergies. When it comes to my role as the Director General and CEO Punjab Population Innovation Fund, I think, as the name would suggest, it is all about innovation. So then we try to connect all these dots together, because well-being is not about having few dollars. I think well-being is just a state, and it can be emotional, physical, and as well as financial. So sometimes we have everything with us, but still no one can say that we are in a state of well-being. So when we deal with the family planning programs, primarily we deal with the couples. We also ensure male engagement. And now, as we know, Pakistan is a young country in the sense that our 77% population is under the age of 40. So we are trying to connect youth in all the possible manners. So starting from individuals, households, families, couples, going to the provincial, to the national development, I think we are playing a big role. And when we talk about family planning programs, we all had a very narrow view, and it was only confined to the consent of a couple and use of a few contraceptives only, and that to either to limit or to give some space between pregnancies. But I think over the years, even family planning programs have evolved so much that now it is all about taking the right choices while having the knowledge and the access to all the medical facilities. And if we can ensure reproductive health, I think our life can change for the betterment. So in Punjab Population Innovation Fund, I'm mentioning PPIF the first and the foremost, despite having two, roles at the moment, because it is about innovation. So this is an age of innovation, no matter at the policy stage, design, implementation, or M&D stage. So we really need to find lots of new and innovative models of service delivery and reaching out to many, and at the same time getting the cost effectiveness. And when it comes to the family planning program that we were running initially, traditionally, I think it was cost effective, but it was not offering much choice to the couples. So now, with the social behavior change communication, we are working, which is a cross cutting discipline. So we are enabling all the communities, regardless of rural or urban, regardless of wealthy or poor. I think it is knowledge is wealth now. So if you have the knowledge at the right time, you can take the appropriate decisions and you can transform your life for a happy and a prosperous future. So the state of well-being, I think, starts with having the perfect knowledge. So we are initiating lots of teledramas, drama serial, trying to break all the taboos which actually block the way to progress for lots of women in Pakistan. So just trying to bring some gender parity with the active engagement of males and youth into various programs. We just finished lots of calls at Punjab Population Innovation Fund level into various districts all across Punjab. And we are ready to implement these models for anyone whoever comes to discuss with us, because they are tested, they all went through TPVs, impact assessments have already been done, so we can proudly present all these models for millions of people out there. And we can also do knowledge sharing, because I think in this age we must be very generous in terms of sharing our knowledge. So we have lots of websites and social and digital and electronic and print media platforms from where we are trying to give this knowledge to all other people. I actually wrote letters to all the provincial secretaries to replicate the model which Punjab Population Innovation Fund has experimented with in the recent past. And most of these models were successful only with the active involvement of the communities. So they are not as bureaucratic. Most of the communities in Pakistan would tend to act in a similar manner. So I think not just for our own communities at Punjab, but for all over Pakistan, we can be implementing these models. And they have been also implemented largely by the private sector organizations. So it's no longer the monopoly of the public sector organizations. And I think it's just a good knowledge share, and we can actually learn and go ahead. Thank you.
Thank you so much, Ms. Saman, for sharing your fascinatingly innovative approach. And I think covering cost effective family planning methods under our social protection initiatives can exponentially support in family planning objectives. Gender inclusion is one of the most important element of social protection, and that conversation I feel is not complete without family planning policy and advocacy, empowering mothers to make choices. So thank you so much, Saman Rai Saiba. And finally, I'm honored to introduce Dr. Aminah Khan, Country Director at Jhpiego, Pakistan. Dr. Aminah brings extensive expertise in family planning and reproductive, maternal, newborn, and child health, quality of care, public health surveillance, disease prevention and control, AMR, HCAIs, infection prevention and control. She has also worked in digitalization of data, designing of health management information systems, electronic medical records of concerning health disorders, disease is also her strongest skills. Previously, with the World Health Organization in Punjab, Dr. Aminah held senior roles with the Hepatitis Control Program and the Infection Control Program. She has held key positions at Green Star Social Marketing and TKT International. Her dedicated work has significantly advanced healthcare in Pakistan. Dr. Aminah, thank you for joining us today.
Thank you for having me, Areej.
So, Dr. Amna, my question to you is that as we explore ways to strengthen Pakistan's social protection framework, how do you see the role of Jhpiego in Pakistan in terms of contributing to making these systems more inclusive, integrated, and responsive in the areas of health?
Thank you, Areej, for this question. I would begin by saying that it is a great opportunity, firstly, to be a part of this very important discussion today. And it's incredibly encouraging to see so many like minded individuals. They're coming together with a shared goal, the goal of building resilient systems, systems that protect people not just in the time of crisis, but throughout their lives. And at Jhpiego, we believe that strengthening health systems and investing social protection are two sides of the same coin. Because when people have access to quality healthcare and a safety net to fall back on, families are more resilient, the communities they grow stronger, and the countries are better prepared for what comes next, whether it's a pandemic, a flood, or a personal financial crisis. So, Jhpiego, which is an affiliate of Johns Hopkins University, has been working in Pakistan for over 2 decades. And it is going to be 30 years in Pakistan in the next 3 years. So, throughout these years, our focus has consistently been on improving access to quality health services, and particularly for women, children, and underserved population. We have partnered with federal and the provincial governments, as well as international and local stakeholders. And we have done this to strengthen the health system, build capacity of the healthcare providers, introduce innovation, ensure community engagement, integrate social behavior change communication, and support the government to deliver high impact intervention. And this is something we have been doing. But looking forward, our vision for Jhpiego aligns closely with the themes and the priorities shared in the recent Second National Social Protection Conference. We are particularly encouraged by the direction Pakistan is taking towards an integrated, adaptive, and inclusive social protection system. So, Jhpiego, we are very excited to support this journey. We aim to help shape a health system that is not technically just sound, but also responsive to the social realities people have every day. For our future work in Pakistan, I would like to say that it would be guided by three core principles. Number one is integration, two, inclusion, and then innovation. So, if I talk about our first core principle, that is integration, we believe that health should be central to all the social protection strategy. And the question might arise why? So, we all know that the health shocks are one of the leading cause of poverty. A single illness, a birth complication, or a burden of managing a chronic condition can drive a household into financial distress. So, when we talk about social protection, access to affordable and timely healthcare must be a part of this equation. And if I give you example, for instance, in Jhpiego, through our group antenatal care project in Sindh that is supported by the Gates Foundation, we organize structured peer-led session where 8 to 12 pregnant women of the same gestational age, they receive clinical antenatal care alongside with facilitated discussions on maternal health, nutrition, and self-care. So in this way, Group ANC is well aligned with the BIS Nashonuma program. And by integrating Group ANC into the service delivery linked with this Nashonuma centers, Jhpiego can help improve adherence to health checkups. It can increase awareness of specialized nutritious food and reinforce behaviors that are tied to cash transfer conditions. Moreover, as we see that Nashonuma expands across 158 districts, so Jhpiego's expertise in providing training, group facilitation, and monitoring systems can ensure quality and consistency at a scale. So the second core principle, that is inclusion. So why inclusion? We all know that many areas of Pakistan, women continue to face major barriers in accessing healthcare. Moreover, these unpredictable climate change, the increasing conflicts, and the rising displacements, these elements only deepen these inequalities. And we believe that gender equality, youth empowerment, and reaching the marginalized population must be central to all future health and social protection strategies. This is our belief. But the question would be, what does Jhpiego do? So we work with the communities to build safe spaces, we foster trust, and we support health-seeking behaviors, not only through services, but also through engagements, dialogues, and empowerment. Our men's engagement project in Quetta and Karachi, which is supported by Gavi, the Vaccine Alliance, uses gender transformative approaches, engaging male caregivers and community leaders to challenge the harmful norms and support women's health and improve decision making. So models like these align with this broader vision and objectives, including programs like Wasila Sehat, Wasila Talim, which aim to incentivize positive health and education outcome alongside the financial assistance. So the third pillar now, which is innovation, defines our future direction in digital health, data system, and climate action. I'd like to explain that Jhpiego has a strong in-house digital health and data team offering end-to-end digital solutions. So from mobile data collection using Kobo and Comcare to machine learning analytics, GIS dashboards, and real-time monitoring. We are at this point already developing tools like genomic surveillance dashboards and the infection prevention control monitoring platforms. And our goal here is to link these with the national systems like NADRA, National Socio-Economic Registries, and the BIS registries. And why do we want to do that is that the frontline workers can access social protection data during outreach. And at the same time, the service delivery can be automatically triggered based on the identified needs. With this dynamic National Socio-Economic Registry, now it's offering real-time NADRA verified household data. There is a powerful opportunity to better align health and social protection system. Jhpiego can enhance impact by integrating digital health indicators into this National Socio-Economic Registry. This would enable targeted outreach, personalized health messages, and there can be effective risk-based planning as well. Likewise, and in parallel, the Asian Development Bank is supporting inclusive growth across Asia and the Pacific by strengthening social protection systems that reduce poverty and vulnerability. We strongly believe Jhpiego is well positioned to complement ADB's efforts by embedding digital health innovations into the broader social protection framework. And joint efforts could focus on building interoperable systems, digital capacity among frontline workers, and co-design tools that strengthen both health and the social protection outcomes. And because no healthcare system can function without its people, we are investing in workforce development as well, especially women from the underserved communities. So we aim to strengthen training institutes, equip midwives, nurses, and outreach workers to become champion of both health and social inclusion. And lastly, of course, none of this is possible without partnerships. So we are ready to work hand in hand with the government institutions, the community support organizations, academia, and most importantly, the communities. And with this leadership and the collaboration of the federal and the provincial health departments and the support partners like Asian Development Bank, we see many strong entry points where Jhpiego can add value, particularly in maternal health, nutrition, and digital service linkages space. So I close by saying that Jhpiego Pakistan is here for a long haul, and we are committed to building health systems that are integrated, inclusive, and innovative, and working together with the social protection to offer dignity, equity, and opportunity to all the Pakistanis.
Thank you so much, Dr. Amina, for sharing your vision on integration, inclusion, and innovation, the group approach and GNC model, the gender transformation and men's engagement project, and the digital health strength at Jhpiego are very fascinating examples which are already in place and that can uplift social protection measures. So, and I think my favorite was this standing next to our healthcare workforce through capacity building initiatives. So, with that, I would like to thank all our incredible panelists for sharing such valuable insights today and to our audience for being part of this important dialogue. Today's conversation reminded us, I think, that social protection and health systems are not parallel tracks, they are interconnected lifelines. With aligned effectively, when they're aligned effectively, they can uplift entire communities, protect the most vulnerable, and build a foundation for robust and more inclusive development. At Jhpiego, we believe collaboration across sectors is not just beneficial, it's essential. So let's continue working together to create systems that put people at the center. Thank you again and stay connected with us for more conversations on our LinkedIn live sessions. You can also watch the recorded version of the session later on our page. Good night from all of us.